The concept of patient-centered care has become a significant focus in healthcare literature. However, this principle seems to have been overlooked in the context of central laboratory services in Ireland. Two crucial factors, time and trust, highlight the potential benefits a central lab could bring to the people of Ireland. The perception of time varies significantly between healthcare professionals and patients. For healthcare providers, the timeline for lab results is often uncertain, with no reliable turnaround time, ranging from weeks to months. However, for patients awaiting results, the passage of time is experienced more acutely. The uncertainty surrounding the timeframe for results can leave patients and their families in a state of limbo, heightening anxiety and stress. A centralised lab would greatly enhance the efficiency of result processing, offering long-term benefits by reducing wait times and improving patient experiences. Timely results can be critical, particularly in life-threatening situations. For instance, delayed diagnosis in women with cervical cancer have led to tragic outcomes, as labs failed to detect and diagnose cancers at a precancerous stage. Similarly, many children in Ireland are waiting for genetic testing, with delays impacting the timely diagnosis and management of various medical conditions. Faster access to test results through a central lab would facilitate earlier interventions, personalised treatments, and better management of these conditions. This issue is not limited to children. Adults awaiting investigations also suffer from delays that prevent timely, personalised care. Restrictions on when and where tests can be conducted often force patients to travel long distances, adding unnecessary stress and expense. A central lab, staffed with adequately trained specialists, could enable more tests to be performed locally, thus alleviating these burdens and streamlining the diagnostic process. Improving turnaround times for lab results would not only expedite access to treatment, but also reduce hospitalizations by enabling early intervention and personalised care. However, trust is equally important. As highlighted in reports by the HSE 2010 and NHS 2008, outsourcing and the use of multiple testing centres without a central lab can lead to adverse outcomes. Numerous cases have shown the detrimental effects of this fragmented approach, and these issues will persist until a centralised solution is implemented. Ireland, known for its high educational standards, could benefit from following the UK's example, where centralisation has improved the reliability and quality of lab work. Establishing a central lab would not only create valuable job opportunities, but also ensure high standards in lab services, providing essential support to the healthcare sector. As a small nation, Ireland has the potential to become a global leader in patient-centred care by embracing a centralised lab system. The importance of early diagnosis and intervention is well recognised, and these goals can be achieved by starting with a central lab. Although establishing a central lab is not achievable overnight, it is crucial first steps are made toward opening a central lab and thus improving patient care in Ireland. The question remains, how long must the negative consequences be endured before change is enacted? How many lives must be lost before necessary improvements are made? On a personal level, our family has experienced profound loss. 9 pregnancies with only one surviving child. We know a central lab would have made a difference in our situation. Although no one intended harm, the pain of losing our sons is enduring. Our son Oisín, born in June 2023 had medical complexities similar to those of our son Ross Jr., who had 22q and passed away due to complications secondary to his 22q. Despite reassurances from medical professionals throughout the pregnancy, our fear of planning another funeral was very real. It was only through the diligence of a dedicated neonatologist and supportive genetics professor that we discovered our family's diagnosis of 22q, which had been missed in early 2021. So many avoidable losses stemmed from that missed diagnosis. Work missed, relationship breakdowns, physical decline, weakening mental health, emotional turmoil, social isolation, and spiritual disconnect. All aspects which, as patients, we suffered the consequences of not having the support a central lab is able to offer. We feel this experience underscores the vital need for a reliable central lab to prevent other families from undergoing similar tragedies.